안녕하세요. 삼성서울병원 치주과에 있는 양승민입니다.
Greetings, I'm Dr. Yang Seung-min of Dental Department in Samsung Seoul Hospital. In today's master course lecture, I'm going to talk about membranes. In this lecture, I'm going to talk about role of membrane, types of membrane, and how to select membranes. The role of membrane. I'm sure you've heard of it when you were studying in school or in other lectures. The membrane creates an enclosed space between the soft tissue and the bone tissue and directs only osteogenic cells into the space to regenerate the bone. As shown here, it provides a space for bone formation. Also, it prevents the penetration of other tissues. It serves as an inhibitor. It has such two roles. Space maintenance. It creates a space. It needs to have certain hardness to be able to provide a space. It needs to withstand pressure from other tissues, so this is very important. It needs to be maintained. As mentioned earlier, it needs to withstand external forces and pressure generated in the mouth. You need to use membrane that can maintain space and withstand external forces. A membrane should also have selective cell occlusiveness. Here's the membrane. I've talked about how within the space created by the membrane, bone cell fills in. In order to allow this, it needs to prevent epithelial cell or connective tissue cell invasion into the space. Another point I would like to accentuate is that it should be permeable to plasma and the nutrients so that the nutrients can go in here. The bony tissue will be able to grow much faster if the nutrients are available. In this area, what would happen if there is an implant? It's the same here. The only difference is that implant is going to be positioned here and the membrane will be applied, and following that, bone fill will occur. Therefore, we need to bear in mind the two traits of the membrane. We need to remember that it needs to make a space and should have selective cell occlusive property. Membranes can be largely divided into non-resorbable membranes and resorbable membranes. As shown on this image, there are different options available. I'm going to address as to how we are going to choose among different options. Let's look at non-resorbable membranes first. I've talked about how membranes need to be able to maintain space, and non-resorbable membrane serves excellent role in this purpose. At times, it can be difficult to manipulate, and once this is exposed, it is very difficult to control this area. So this is not frequently used, and because it's non-resorbable, so it requires additional surgeries. It's very unfavorable in that respect, but as mentioned earlier, space maintenance and cell occlusiveness are excellent. In that respect, many people use this. I'm part of the Korean Academy of Periodontology, and if you look at the data provided from there, there are different options. non-resorbable membrane can be largely divided into three: EPTFE, high-density PTFE, and titanium. You can see that there are many more different options here. EPTFE membrane, DPTFE, and titanium mesh. These are the primary non-resorbable membranes that we come across. EPTFE membrane is abbreviation of expanded polytetrafluoroethylene membrane. This is considered the gold standard of non-resorbable membrane. I don't exactly recall when, but since the late 2010s, it is no longer manufactured. It is now commercially unavailable. If you look at the literature, many say EPTFE is good, but clinically speaking, there are many difficulties such as cost and the ability to manipulate it. DPTFE was introduced to replace EPTFE. If there is a vertical bone defect, in the past, people used EPTFE membrane to do vertical reinforcement, but now DPTFE membrane is used. This is a dense polytetrafluoroethylene membrane. This is an inert PTFE membrane which is non-expandable and non-permeable. I've talked about how membrane should be semi-permeable. But this membrane is not permeable whatsoever. This is both advantage and disadvantage. This can be used as a replacement for EPTFE membrane. The biggest difference with EPTFE membrane is the size of the pore. If you look at the pore size difference, in the case of EPTFE membrane, the pore size is about 5 microns. Yes, there is difference between outer and inner. Inner is semi-permeable, so the pore size is a bit bigger. As for the outer, it should not be semi-permeable, so it's smaller. On average, it is about 5 microns. As for DPTFE membrane, the pore size is 0.3 microns. So this is the pore size where bacterial infiltration is impossible. If you look at EPTFE and DPTFE membrane, once it reaches 5 microns, it looks very loose here, but it doesn't whatsoever in DPTFE membrane. Even when there is exposure in oral cavity, it has resistance against the bacterial invasion. The downside is that because it is very tightly knit, fibroblast cells cannot branch out here. So there may be difficulties on this end. As shown here, in the defect area DPTFE membrane was used, it can be removed very easily. In the case of EPTFE membrane, it can be hard to remove, and titanium mesh can be very difficult. In the case of DPTFE membrane, it can be removed easily regardless of whether or not it has been exposed. Finally, I want to talk about the titanium mesh among non-resorbable membrane. More so than anything else, titanium mesh shows excellent space maintenance capability among non-resorbable membranes. Those of you who have used it will know about this, but below the titanium mesh, a pseudoperiosteum is formed. This is a tissue that is 1 to 2 millimeters in thickness that is not granulation tissue nor bony tissue. There is different opinion as to whether it needs to be removed or not. This topic will be addressed in the future. It can be flat, two-dimensional, or three-dimensional. You need to design it following the defect form. This can be a bit uncomfortable. Compared with other membrane, it has excellent space maintenance capability, and even if it is exposed, it is more favorable in terms of infection control. Yes, if it is exposed, the quality of newly formed bone will be affected. This is the advantages of titanium mesh. OSSTEM has introduced OSSBuilder in order to address many disadvantages. This is in fact the same as titanium mesh. It is 3D, it is three-dimensional for surgeons' convenience, and the biggest problem with titanium mesh is possibility of exposure. Special anchor has been used to minimize such possibility, and that is the advantage of OSSBuilder, a titanium mesh. As you can see, there's significant defect and bone augmentation is done. In order to maintain this form, titanium mesh was used and suture was done. When space maintenance is necessary, vertically and horizontally, you can consider using titanium mesh. These days, resorbable membrane is used more frequently than non-resorbable membrane. This is because additional surgery is non-necessary, and when exposure occurs, it is easier to control. The basic principle is that we need to avoid exposure, and this should be abided by. With the resorbable membrane, we can get good results in this way. Resorbable membrane can be divided into synthetic and natural membranes, and as you can see, there are much more natural options available. I'm sure you're familiar with some of the labels here. These are all natural products. Let's look at how these are made. This is based on the extrusion and coagulation of diluted solutions of collagen. Through manufacturing process, these products are made. In most cases, type 1, type 3 collagen is used. We get these collagen from pigs and cows. It is really helpful in healing and it has excellent manageability. It can be applied in clinical situations very easily. Unlike a non-resorbable membrane, the downside of resorbable membrane is that it lacks the capacity of space maintenance. If you look at the cross-section, it has a multi-porous structure. The surface is like this. I'm sure you're aware of this already, but resorbable membrane made of collagen can resorb very quickly and may not provide space maintenance sufficient for bone cell proliferation. That is cited to be the limitation of resorbable membrane. Many ways have been sought to reduce the resorption rate. This is natural cross-link way. Collagen fiber is cross-linked to reduce the resorption rate. Cross-linking method is used frequently. In the case of natural cross-link, resorption of collagen occurs nicely and there's no remnant. However, in the case of use of chemical cross-link, glutaraldehyde is used and this will intensify the cross-linking effect and will reduce the resorption rate. However, after collagen is resorbed, glutaraldehyde, the linking material, will remain. There can be a bit of toxicity because of remaining glutaraldehyde. However, by adjusting the density of glutaraldehyde linking material, we can prevent such problems. As shown here in this defect, a resorbable membrane was used to gain vertical bone augmentation.
수직적인 그 약간의 수직적인 부분을 수복을 한 거라고 보시면 되고요. 나중에
This is after healing.
이렇게 다
Resorbable membrane was used, however, sufficient amount of bone regeneration was gained.
이거는 이제 링킹 머티리얼을 썼던
This was a case where linking material was used.
같이 디펙트가 있는 부분을
In the same way, where the defect is, a linking material
멤브레인을 쓴 거고요.
added the resorbable membrane was used, and after 4 weeks, you can see that it still remains after 4 weeks.
보시면은 그래서 이러한 부분들은 저희가
Depending on the linking material and linking system, we can adjust it. So if you use resorbable membrane accordingly, you'll be able to sufficiently address the problem of early resorption.
자 그러면 지금까지
Up until now, we have talked about the role and types of membranes, and now I'm going to talk about guidance as to what kind of membrane to use in different clinical cases. This is to help you navigate through clinical treatments.
이런 걸 보시면은 이제
The defect is like this. This is dehiscence defect. In this case, what kind of material should be used for bone augmentation? In the beginning, you need to choose whether you're going to use non-resorbable or resorbable or other kind of treatment modality. You need to have a set of criteria as you approach clinical cases.
제일 중요한 거는 말씀을 드렸지만
You need to consider how much space maintenance is necessary, and also resorption rate should be considered along with the amount of bone regeneration required.
재생을 시켜야 되는 골의 양은 어느 정도인가를 선택을 하셔서 구분을 하셔서
We need to think of this aspect and choose materials accordingly.
그래서 그 앞에 있는 두 가지 이 두 가지는 골 결손 부위를
We first need to understand the bone defect type first, whether this is a vertical, horizontal, or composite defect. Following that type, we need to choose the right options for space maintenance and choose the material with the right resorption rate. Be it vertical or horizontal defect, we need to understand how much bone regeneration we can achieve by using different types of membranes.
골 결손 부위는
Bone defects.
선생님들이 타입 1, 타입 2, 타입 3, 타입 4로 구분하는
We know about type 1, type 2, type 3, and type 4. GBR is used frequently for treating defects.
어느 정도의 골
How much bone regeneration can be gained with GBR? This is not the absolute answer, but in most cases, if you have used a resorbable membrane along with particulate bone graft materials, then you would gain about 3 millimeters. If you have used a non-resorbable membrane, then you would gain 4 millimeters. It would be 6 millimeters if block bone is used, and if titanium mesh and particulate bone material are used, 9 millimeter of bone regeneration can be gained.
이 정도를 참고를 해서
This is not an absolute standard. You need to understand the defect and determine how much bone regeneration you aim to achieve. And following that goal, you need to find the right material. When I come across this kind of defect, I have achieved this kind of result by using particulate bone graft material with non-resorbable membrane. What would you do?
선생님들도 마찬가지로
I believe you need to form your own set of criteria and proceed with treatment.
결론입니다.
Moving on to conclusion, first you need to understand the role of membrane.
차폐막 역할을 아셔야 되고요.
You need to understand this.
중리에 대해서
Also, you need to understand the different types of membranes.
저희가 수술하고자 하는 부위에
Following the amount of bone defect and the bone regeneration that we hope to achieve, you need to choose accordingly, and then you'll be able to get good clinical results with membranes. Albeit in a short time frame, I've talked about role of membranes, types of it, and how to choose them. As mentioned at the very last,
어떤 디펙트에 있어서 결손 부위에 있어서 어떤 재료를
It is
이용해서
really difficult to address everything in regards of how to choose what kind of membrane and what kind of defect within such a short time frame. So if opportunity arises, I hope you participate in offline lecture and have meaningful discussion with me. You'd also be able to participate in hands-on practice as well. Thank you for watching.